to another special episode of Young Urban Moms, where we are covering the COVID-19 pandemic. Today we have with us, Carol and I have with us two special guests. We have Cristina, who, it's funny, I forgot your last name, and like you just go by Cristina La Doula to me now. So basically, guys, she is a doula, and it's really interesting because we have a very special childbirth episode planned, and Cristina was supposed to be in the studio with us on that show when basically like the COVID pandemic really hit home and they shut everything down. So it's interesting how things work out, because I kind of feel like it's more relevant for us to talk to her now than it probably was even then. So welcome, Cristina, and she will let you talk about your company and all that good stuff. But I also want to introduce one of your clients, Mika. Welcome, Mika.
Thank you. Thank you for having me.
Of course. And so you're expecting, how far along are you? Because you look fabulous and one would never think you were pregnant from the neck up here.
Oh, there's a lot of like pressure, huge belly thing going on below this camera, but
I feel like we all kind of have that anyway now after eating for 2 weeks, but yeah.
Yeah, so I am 36 weeks pregnant, and this is my first. So of course, on top of already being super anxious and excited, now this has happened. So there is a lot to wrap my head around at this point.
I can imagine. So Cristina, we're going to get back to you, Mika, but Cristina, if you want to just get into, first of all, what's the name of your company? What kind of services do you normally provide as a doula when things aren't going haywire?
So my company is Mammissi Birth Services, and we provide full spectrum birth services. So that would include if we're supporting someone through a loss or a termination. We don't charge for those services, but we gladly will find you a doula to support you through that. We also have full doula services, so birth services. If you're expecting, it can start as early as 8 weeks for some clients ready to book, and others as late as 36, 37 weeks I've had clients book. We also have doulas who only provide postpartum doula services, so they support you after you have your baby. A lot of women sometimes don't have the help or their mothers around or their elders around to support them. So having a postpartum doula really helps. Make sure that you're breastfeeding adequately and that you are being supported. We also have night nurse services. So if you want a doula just for postpartum during the evening, so late at night, we also have that as well. So a doula isn't just for birth. We doula throughout the entire the entire reproductive period. So anything that may come up, we support through. We also have trainings for doulas, and that has been put on hold right now, but we are trying to expand virtually.
And can you define like what is a doula? Because I know when I was pregnant, I had a midwife for my daughter, and everyone was like, "Oh, you need a doula now, and you need a doula too, for my son." So just kind of give us kind of a brief description of what it is that you do and what it entails.
Sure. I think I'll do a comparison with midwives, because a lot of people get confused and think, well, if I'm birthing at home, I just need my doula. I don't need a midwife. A midwife is medically trained. They are also in our state, in New Jersey and New York, need to be licensed by the Department of Health. So it isn't just like a doula will support you, will educate you throughout the process, stays with you the whole time. So some people, you are experiencing contractions, you might not know how many centimeters you're dilated, but you need that support. You need that person to be there when you're ready, and your midwife won't come till you're really in active labor. Things are really picking up. Home birth, hospital birth, it doesn't matter. It's the same. Your doula's there long before then. You're also creating a relationship. So you'll have prenatals, phone calls. I like to check in with my clients after their doctor's visits, a text, a phone call. If I know my clients are agitated, upset, anxious, usually they'll text me and tell me that. And then I'm like, can I call you? Can we talk about this? it's a different kind of relationship, but there's nothing medical that your doula does. So I will not take your temperature if your water broke. I will instruct you or your partner to. I don't take blood pressure, check your blood pressure. I don't check your dilation. I don't do anything that's medical. That's your midwife. So your midwife would do the medical things. And I don't catch babies. Your midwife would catch, or you would catch.
So with that said, I mean, that's a lot just during normal time, but I can imagine how freaking crazy your life has gotten in the past week with basically the pandemic hitting home now with the childbirth process. I mean, I'm not an expert. I just know what I'm hearing on the news. And basically, it seemed like a few days ago, hospitals are now really trying to get in overdrive with protecting their staff and their patients from basically being exposed to the virus. And so now with expecting mothers, it seemed like in New York City, at least a few days ago, they were saying that there wouldn't be any partner able to be present during the childbirth process. And then it seems like, from what I heard this morning, now they're reversing this to one partner. But, you know, we were talking offline and you kind of noted that it would have to be a healthy partner that would be allowed to be present during childbirth. So can you tell us a little bit about what you understand these laws to be and how you're impacted and what you think about them?
And Mika also, if she can chime in, because I know you're probably thinking of that.
Oh yeah, we're gonna go to her next because I'm sure she's speaking out.
Yeah, it was really, I think it was shocking to me at first to expect a woman going through this, or a birthing person going through this transition, to expect them to do this without someone that they love. Or even like forcing them to do this alone. Like it's different if you don't have a support person. But you have your partner that you love that helped bring this baby into this world. And then you may have your mom, you may have a doula, and to have all of that ripped away from you, I'm sure for the people that are birthing in New York, or that were birthing in New York, I'm hearing that it was extremely traumatic. So a lot of these postpartum virtual groups that some of my friends hold, a lot of them are having PTSD symptoms, having postpartum depression. It was very traumatic for a lot of them, obviously. So for me, it's really sad. I've had an influx of calls and emails of people wanting to have unassisted births, wanting to transfer over to birth centers and have their babies at home. And how does that process work? So we only have 2 birth centers in New Jersey. I know there's one in New York City that's in Brooklyn. They are inundated because everyone's trying to have the birth that they desire in this uncertain world now. It's like the only thing that was certain was that I was having a baby at this place and this person was going to be there. And now it's completely shattered for so many families. And it's really heartbreaking. Just because the law isn't stated, and like you said, who is there to determine that their partner is healthy? So what's going to happen? Are they going to take their blood pressure? Are they going to take their temperature? Are they going to give them a COVID test? Like, they won't find out the results for 10 days. So who is going to determine that this partner is healthy and hasn't been exposed?
So is this being mandated though, like, and carried out on a state level? Or is this like kind of every hospital or birthing facility is kind of figuring it out as they go and kind of subject to their own interpretation of this? Because that's a little worrisome too, right? It's like one hospital I know I saw with construction workers that, you know, obviously now we're down to the bare bones with essential projects. And even then I saw that they had a doctor on site with an iPad kind of thing that would take people's temperature on the spot. And anyone who had like an elevated temperature was rejected and sent home. So, I mean, I feel like it seems like this might be loosely interpreted by each facility, and that is a little scary. But how are you being disseminated this information?
But that's pretty much what's happening. They're just figuring it out as they go along. I know in New Jersey, they kind of do what New York does. So they were slowly going down to no visitors. There is one hospital. I just had a client give birth to a week ago, and they were only allowed one partner. One person can come upstairs to the birth to L&D, and then after her birth, no one was allowed. You weren't even allowed any visitors at postpartum. And if your partner, whoever was there with you during birth, went with you to postpartum, they couldn't leave. If they left, no one else would be allowed in. Yeah, so like not even a visitor during postpartum. You have to sit there for the 36 to 48 hours by yourself and your new baby and kind of try to figure it out. I'm hearing that nurses are also being assigned only one labor person to reduce infecting each other or infecting. I don't know if that's true, but it's just really, all of it's really scary because it feel like they're just trying to figure it out as they go along because this is all new. And New York is, the forefront of all of this. It's the epicenter of the pandemic for us in the United States. And, I just wish we had more midwives.
And it kind of reminds me when I had my daughter. I had my daughter with a midwife, and what you described is actually great because I was like, wait, why isn't she doing more? Why isn't she with me before or after? Like I just felt very like it was a very brief kind of relationship. But I had my daughter a month after 9/11, and I was trying, like literally her birthday. She was born the 11th. They were kind of allowing visitors, but they were very strict as to who was like how many people, like way more stricter than they normally are, just because it was like the 1 month anniversary and there was just like a very kind of tight lockdown. So for me, that was traumatic. Like I didn't even want to save the newspapers. Usually there's like, oh, let's save the newspaper from that time. And I didn't want to even look at the news. Like it was just, so I can even imagine what many moms are going through now, just going through this entire experience of like, the birthing experience of your child is not just your hospital, but just what's going on in the world as well. So yeah, Mika, I can't even imagine what you're kind of at your stress level right now, in experiencing all this, with just a few weeks to go, pretty much.
Right. I mean, when I first got the news, I'm going to be honest, I ugly cried. Oh, I ugly cried for so many hours. And my husband, he just looked at me and he kind of like, I don't know what to do, and just try to be very supportive and comforting to me. But I just felt like I lost control out of everything. Going into this, mommyhood for the first time has already, it's been stressful because of getting the news of like, okay, I have to bring a child into this world that's uncertain, and I already had my own fears beforehand. And Christina's been great in just educating me and getting me ready. So I thought I had this plan going into the hospital. At first I was choosing a hospital, and then everything before a couple of weeks I have left gets shut down. So it was traumatic, and I couldn't take that as an option. So I sat down after I went through my emotional roller coaster and said, okay, what do I need to do? So I started researching and looking into birth centers for an option. And fortunately, I was able to make that hard switch to a birthing center. So I'm still nervous because I don't typically like to make such last minute changes. I already had it in my mind, a plan. But I think that's what the importance of having a doula is, because I think without one, I would have felt unprepared to kind of retrain my brain to understand that, this is a safe process, this is going to be a good one, and I don't necessarily need an IV hooked up to me or treat it like a medical event. But that's what I've grown up to seeing. So right now, it's just that rewiring my brain, but having a doula really does help me get to that place much faster than I would if I had no support in that area. So it's definitely a lot, but for the baby, like anytime I start crying, I feel the baby moving more or like saying, hey, chill out, mom. So I'm like, okay, I have to stop crying. Like, okay, I gotta buckle down. But it really makes me see that, this is, you as mothers who are more experienced, this is the job of a mom, that you have to fight and do whatever you need to do to protect your baby and yourself.
Yeah, and they remind you. They
Welcome
do
to
remind
my
you. Um, if your baby's already kicking, you're already very much forming that relationship, or you've already formed it from the moment
Yeah.
you felt it. But yeah,
And
they
I
remind.
felt so proud of myself too, to just, I was getting told no in so many areas. The hospital said, no, you might be alone, no doula, now no partner, you're too late to go into a birthing center. And it was all these no's, and I was just like, no, I can't do this. It's so traumatic for me to even think that I would have to birth alone.
Mm-hmm.
Like, I already have, growing up, I had a sick relative, my grandmother, who was always in and out of the hospital. As a woman of color, I've always seen her had to fight for her health care growing up. So I have this disdain for that environment already, but I felt, okay, well, I have a doula, I have my husband, I'll have my mom, I can make this work. Now you've taken that away from me, and all I can imagine is just laying on a bed, asking for help, and people are overrun, overtired, and ignoring me.
Mm-hmm.
And Black and Latino women, we're already at a high mortality rate anyway. So all of this is now on me, and I have 4 weeks to go. So it's just, I just, had to make the decision right then and there, birthing center, and just educate myself as much as possible.
So, what really is the difference between a birthing center and giving birth in a hospital? I mean, it seems like I'm getting the impression they don't have to follow like the same rules or protocol that a hospital does. So, can someone explain that to me? Because I honestly never knew. And as a mom, Mika, further down the funnel, I mean, I wish that I would have like actually had a doula. I wish that I would have actually like did my homework and researched a little more instead of kind of like you just described, taking what, has been the status quo, because I ended up having like both of my kids in a hospital, and it was but it was definitely not like a great, magnificent experience. So yeah, what's the difference? Like, what is the benefit, even outside of these crazy times, of giving birth in a birthing center?
So a birthing center is the closest you can come to birthing at home, but you can have an OB present. So the practice that Mika goes to is run by an OB. She's an OBGYN, and she also is the owner of the birth center that is adjacent to her office. She is not the only one who has clients birthing there. She also has midwives birthing there. She also has a midwife on her team, but they own it. And as long as you're cleared, so you're low risk, you don't have any high blood pressure issues, you don't have gestational diabetes, those things will kind of phase you out and you won't be allowed to birth at the birthing center. But it is a beautiful, serene, it's like a really nice hotel that you get to have your baby in. You don't have to clean anything up. Your whole family, if you want, can be there. Right now, it's a little different. They are limiting visitors, but I have had births there with clients, and their children were there, their brothers and sisters, mother-in-law, father-in-law. Everyone was at the birth center awaiting the birth of their baby. We get there in active labor, full-blown active labor. So you have to be 5 centimeters to be admitted into the birth center. The only pain relief you'll receive are these hands and some oxygen if you need. There is also nitrous oxide. So laughing gas is available, but that's like last on the list to use. I'm not sure if they're even using it now because of COVID.
You mentioned there's one in Brooklyn. I thought there was also one in Manhattan, or is there only one in?
They closed the one in Manhattan.
Oh wow. Okay. Wow.
Yeah, last I heard,
Yeah.
that one is closed now, and the only one available is at the Brooklyn Birthing Center.
Which is sad. You would think they would make more.
Very sad.
of
If
closing.
you knew how many births happened in all of the 5 boroughs and how many hospitals we had for birthing people, you would be shocked.
Yeah, I mean, when I had my son, I was looking at that one. I think it was in Mount Sinai.
Yes.
Yeah, I was looking into that one, and they were full. So I ended up doing it in a hospital for my son, but I had I didn't have a doula. My friend is a doula, so she would kind of substitute one. And then I had a midwife again. But it was, I tried doing as much natural as possible with both. My daughter was all naturally, not my son though. Because it was just, I don't know if it was age, but it was a lot more painful than my second one. So.
I've also been getting a lot, of people during last week when I thought, I would have to birth alone, that, I understand it is they're trying to protect the baby, mom, and staff. But I feel like a lot of people said, well, years ago, women did this alone. You'll be fine. And it came off insulting to me because, there's a reason why we don't do things like that anymore and we do things better.
Yeah.
And I did see like some physicians are saying, well, I hope people don't go start having babies at home births or birthing centers. And I did see like a lot of negativity around the topic of women trying to switch over to the birth center. And that was very disheartening to me. But I don't know, like if you ladies think like why that is, or, kinds of what you would say to those people.
The reason women used to birth alone in hospital settings are because they were given a drug that will completely like erase their memory. They were strapped down to the table and they didn't want their partners to see that. Babies were born via forceps. They were literally grabbed in the womb and yanked out. The trauma associated.
Oh no, your audio.
We can't hear you.
Oh, I think her your one.
And I don't know. I think if you are a healthy person and everything has been fine up until now, there are things that can happen. This is why you need a midwife, a trained midwife. There are still lay midwives in Pennsylvania that know what they're doing. They've been apprenticing with people for 20 years. So I think if you're with a trained medical professional, you will be fine because they know when you need extra help, when we should transfer to a hospital, when things are necessary for us to move along. And that's the process of you trusting your provider. But to take that option away from women because of COVID is extremely unfair and disgusting, because then that takes away all of our rights. That takes away all of our autonomy. That takes away all of our choices.
And I know I have a few friends who are pregnant who are white, and a few who are people of color, Latina friend of mine and then a Black friend of mine. And it was interesting because one of my white friends was like, well, I'm accepting it and I'm ready to give birth by myself if it's for the safety of my child. And in my mind, I'm like, that's great. But I would feel scared for my two other friends who are like, I would be scared if they were there on their own, because the risks are just, when you look at the numbers, the risks for women of color giving birth are just insane. You have Elizabeth Warren, one of her platforms when running for president was specifically for that, to help women of color just safely give birth. And we're talking just safely giving birth. The postpartum care is ridiculous. So when those stats are there, you don't have that freedom to be like, what, I will trust you and go in by myself, because we don't.
I'm so glad you said that.
Don't even know. I mean, what really? Like, I that does not make me feel too happy to know that it'll just be me and a bunch of people that can easily cover or not tell me exactly what happened.
And that was triggering for me when I'm so glad you said that, because I was reading a bunch of comments, and the women who were saying that were white women, and it triggered me. And I know they didn't mean anything by it. I mean, they're, trying to accept it and find their own ways to deal with it. But I was just thinking, quite honestly, how nice that must feel to be okay for you. And I don't have that same privilege. of feeling that. Even before the pandemic, I didn't have that. So it was very triggering to read that, and I did have to take some time offline to stop reading things, but I'm glad you did mention that.
Yeah, yeah. And I mean, like you said, it's great if that's a choice, of course, if you have no other choice. I mean, legally, thankfully, they changed it recently, but it is a very different lived experience, especially for women of color. So I mean, that was another question that we had, just kind of like, how do you kind of see the rise in home births, and just a change in the coming, I mean, you're already experiencing now, but you kind of feel like you can kind of foretell what might be in the long run happening with how women are giving birth and just that experience in general?
Yeah, I've already seen like a culture change before this. I think, especially in our community of women of color, like coming out and looking for their options and really exploring having a doula and having a midwife and maybe birthing at home. But now with all of this happening, I think it's really going to give people the, I don't want to say push, but kind of the confidence. It's like, well, my cousin did it when this pandemic was happening, so we could totally do it in December, which I know a lot of babies are going to be born this winter. So I think it just gives them the confidence that this is okay. I'm healthy. We'll be healthy. Everyone's fine. There's nothing for us to be afraid of in having a home birth. I think it's just harder to get the men along. It's always been.
Well, speaking of the men, I was actually going to ask you, Mika, and if we're reaching too far, you could tell us to mind our business. But, you know, I think you had mentioned before that you have a husband. So I was wondering how he's feeling, you know, about the possibility of not being able to be present when that was something you were pondering.
Yeah, I think, you know, he's been doing a great job at understanding that I already have anxiety issues. And so he's been, okay, so you get it. I'm already an anxious person, and he's great because he's laid back, and he's probably the only person in my life ever who can calm me down when I'm really stressed or really anxious. So he's been doing a good job at just trying to give me the great poker face and saying, okay, like at first when he thought it could be only one person in the room, he said, would you like your mom instead of me?
Oh.
And I was like, oh no. And he's, and I caught moments when he admitted to me, he's like, I'm trying not to be emotional for you. Like, I just want to be strong for you. But he was scared. I think mostly he's just scared the closer we get to it. He's scared for me, and he keeps saying sorry to me. like I'm sorry to put you through this. I'm like, wait, no, we made a baby together. It was a decision. But I think it's just, for someone in his position, and probably for other husbands in this position, it's like they don't know what to do. They want to help, and they're just like, please just tell me, I'll do it. But I think he was just trying to do his best to make sure that he wasn't showing that he was stressed and sad, because he was trying to just be there for me and let me experience my own emotional journey through it and just listen. So he's been really great at that. But I try, now that I'm, able to talk about it a little bit more, I think it is important for me to sit down and just make sure, like, how do you feel and what's going on in your head, so that, I consider his feelings, and that it's, it's not, I know it's like, he's like, it's all about you. You're the one carrying the baby, but we're partners. So I want to make sure, like, that he feels that he has a voice and that he can express what he feels too. But he's been great so far. Fortunate for that.
You lucky girl. You better hug that man. But I mean, in general, I feel like it really is a delicate balance, because I understand that, like, the real threat of the virus is that it's so easily transmitted and then spreads like wildfire, literally. But I do think the importance of having a support person, not even just in childbirth, but just in general when you're going through anything, it's being kind of downplayed right now. Like, it's kind of being seen as not a necessity. And I think, and this is a whole other episode, I guess, but I definitely feel like it's becoming, I don't know, a bit of a catch-22 right now, and like really a major cause for debate. So I'm happy that you were able to, you know, with Christina's help, and again, can't stress the importance of a doula enough, everybody out there. But you were able to make this decision and still find a solution to not be alone when you're giving birth, and kind of find a workaround around, you know, these laws that are kind of being, I don't want to say hastily made, but you know, I guess that's what I am saying.
And I will add this. This is an important story too. That he was recently fired from his job because I had came down probably at the beginning of this quarantine with a bad sinus infection. Of course, the ear infection and the sneezing. They said, well, we're not testing you for COVID. It's just a really bad ear infection and sinus infection. So he had concerns about work. He works in the city and traveling back and forth to his office, home every day. So he asked his job, my wife is sick. Here's a note. I'd like to take my time off to be with her during this time while, you know, she's self-quarantining, and be with her and make sure she's like almost giving birth anytime now. And his job denied it. And he said, okay, well, what can I do something else, take unpaid leave? And then the next day he gets a call and say, you're terminated. Don't come to work.
Wow.
Yeah, and he doesn't have an essential job, or was considered an essential job, but they fired him and said in the termination letter that his reasons for or concerns around the pandemic wasn't justifiable to take time off, even though he provided them with the note and said he didn't want to possibly expose me because we're so close to delivery, or possibly expose his coworkers if I had something. And they just did not work with him. So it was a hard choice because I think inside he knew if he didn't show up to work, they'd give him a problem. But it was that kind of decision that he had to make and say, okay, if I do this and they fire me, are you okay with that? And it was more important that we're healthy, that he was going to be able to be there with me during my birth. And that's some of the hard decisions that I think, you know, us and probably other families have to make right now.
Oh, he should seek unemployment.
I was just going to say, and legal action, because that sounds
yeah.
Oh yeah, I had time today, so I was all the emails.
Contact the Department of Labor, like, you know, he
Yeah.
should file and fight that. I mean,
we have all the email threads together, so we're just, you know, waiting. I mean, there's so many things happening right now, but that was like another stress factor on top of everything, getting that news. But yeah, we're definitely
the pandemic in early March, so you know.
Yeah, this was they let him go March 18th.
Oh, yeah, he definitely has a case.
Yeah, so and you know, in that environment, it's like it's an IT department in a basement, no ventilation, just guys on top of each other with boxes all around. So it wasn't like, you know, like he wasn't going to get exposed or couldn't, you know, like they felt that he overreacted when he tried to explain to him his concerns and his reasons, and he had time to take off. But I think it also had a lot to do with he was about to take his paternity leave through the New York, I think, Family
Act. Yeah.
Yes, and I don't think they were too happy about that either. So I think, in my opinion, it was a way to just kind of get rid of him anyway, so they don't have to deal with that.
Well, this sounds like we need to have you in the studio when this
Follow
up on that
pandemic repercussions. But It's interesting. I mean, you mentioned, you know, the whole family act leave, because I think and you, Cristina, talked about just changing the mentality around birthing and moms and the birthing experience, and the postpartum experience, especially because I know when I came back from work with my son. I remember I was in a meeting, and one time I was like, oh, I'm exhausted. And one of my coworkers said, well, you just got back from vacation. I was like, what the fuck? I literally, the days were a blur those 3 months that I was on maternity leave. But it was just kind of like this idea that like, it is such an easy thing. You just kind of go in, come out with a baby, and you're happy and everything, you know, is great. But I mean, I just kind of wanted to get from you and even you, Mika, but Cristina, like kind of like this whole, you know, you mentioned there's going to be more babies in December. Um, and just like in general, our population, I mean, how we see people even is changing. Like, you know, let the old people die and let the sick, you know, kind of how do you see us as like, you know, you know, if we come back to you next year, what you do you think your experience is going to be like as a doula and just kind of seeing the scope of things with everyone around?
I don't know. I don't know. I'm hoping this makes things better. I hope that we see our power in numbers, our power in unity when we come together and work towards a common goal. And that's pretty much why this happened, why Governor Cuomo signed this into effect, because everyone was outraged. How dare you tell us that we can't have a support person? How dare you? We understand the ramifications, but how can we be denied this right? So I hope it opens people's eyes to the fact that we can make a difference. It's all about, if you don't show up to the hospital, if there's a decline in numbers, it's still a business. It's a major machine, money-making machine. You can birth in your apartment. It'll be okay. Your neighbors will be fine. You can find a midwife who'll come to you. You can birth at a hotel. You can do whatever you want to do. And once we change the narrative that birth is a medical process for everyone, because for some people it is, it has to be, but it's not that way for most of us, for the majority of us. Once we change the narrative, then people will understand, oh, I could totally do this. But it takes the few to be like, that's it. Like Mika was like, nope, I'm not gonna stand for this. We're gonna make the fight, and I'm gonna do whatever I have to do until 40 weeks to see if we can have another option. So that's my biggest hope for all of this, is that it just changes the narrative for everyone.
Wow. Well, we've taken more time than we had planned to take from both of your days. So in parting, I'd like to ask both of you what you would want expecting mothers to know out there in dealing with this pandemic. Like, what would be, you know, your advice?
I think my advice would be to other expecting mothers is that, woo, you know, I think you're allowed to cry, scream, get mad. You're allowed all those emotions. And I think once you settle and just have a moment to yourself in silence, I feel like just listen to yourself and trust in yourself, because it's true. Before I even gone through this experience, I've heard other mothers say, you'll know what to do when the time comes as a mom. And I just, whatever was in me, I felt it was my fighting spirit to just look for solutions and look for the betterment of myself and my baby and my family, and just trust those feelings, despite what everyone is telling you, even if it's a bunch of no's. Just to do your research, educate yourself, and fight for your own health care. That's really what it is. But, you know, go through your emotions first, and, you know, and then take that breather, and then, you know, do as much work as you can. And don't be afraid to ask for help.
Your turn, Cristina.
I think the same thing. I think trust in your gut. Piggyback off of Mika, like trust in your gut, because you could do this. There isn't, you know, anything that is impossible in the moment. Like that motherly intuition, it's already inside of you.
Wow, that's deep. Well, I co-sign all of that. I'm sure Carol does too. As two mothers long removed, twice removed.
And welcome, Mika.
Yes. So best of luck to you, Mika. We definitely would love to have you back, whether it's via Zoom like we are now or in the studio. And you too, Cristina, when they open up the outside again, we definitely plan on having that childbirth episode. This was just a tip of the iceberg. So Thank you guys. Stay safe.
And Mika, share pictures if you're sharing. So
Yes.
Yes,
We want pictures and we'll share them with our Yum audience for sure. So,
great. There'll be lots.
yes. And for everyone out there, if you have questions, you can at us at Young Urban Moms and we will filter them. I don't know if you guys want to drop your social handles so people could hit you up directly.
Absolutely.
Go ahead. Tell them where they can find you.
At Mammissi Birth Services on Facebook and Instagram. We are on Twitter, but not too active. So catch us on Instagram or Facebook.
Dope.
And, I have a couple, but you can find me at Mika Kenyah on Instagram and Facebook and Twitter, as well as at Ron and Mika. My husband and I are comedians and media personalities, so we like to do a lot of funny things on the internet. So check us out there. And then I have a podcast with my fellow Afro-Latina, and it's called At These Two Locas. So check that out as well.
yes.
Oh, snap. And we'll be reposting and sharing some of your stuff on Yum. So stay tuned, everyone. And thanks, guys. Bye.
Thank you.
Thank you. Bye.